Hi everyone, Dinesh Sirasena here, and today we're going to be talking about imaging the dorsal aspect of the wrist. As with my previous talks, I recommend two resources. Firstly, the ESSR guidelines on musculoskeletal imaging, particularly the wrist joint, and secondly, ultrasoundcases.info. And here are the images from the ESSR guidelines when scanning the dorsal aspect of the wrist. You'll see the radius, the lunate, the capitate, and the third metacarpal. Over each of those, there will be a joint capsule, and there will be a degree of continuity between these areas to form the wrist joint. Here are some further images from the ESSR guidelines. It shows the position of the hand with the orientation of the transducer when undertaking the imaging. There's also an impression of what you will see. So again, you will see the radius, the lunate, the capitate, and the third metacarpal, with the various joint capsules overlying. In practice, when undertaking imaging of the dorsal aspect of the wrist joint, I either have the patient sitting upright with the hand placed flat on the examination couch, or I have them lying supine with the palm again placed flat on the examination couch. This latter position tends to be a lot more comfortable for the patient and also a lot more stable for you, so that hopefully it optimizes your images. To get an overall impression of the wrist, you can place the transducer in a long axis orientation over the wrist joint, and as with the ESSR guidelines, this is what you will see. The third metacarpal from distal to proximal, the capitate, the lunate, and the distal radius. Overlying, you will see extensor tendons, the joint capsule, and also the skin and fatty tissue. Here is an example of a wrist synovitis. This image is from ultrasoundcases.info. In this situation, you can see there's increase in hypoechogenic areas around the joint, and there's also an increase in vascularity. Thanks for watching. I hope you found the video informative and it adds to your knowledge of musculoskeletal imaging. If it did, please remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter and Instagram, and remember to check out sportsmedinfo.sg. Thanks again, and I hope to see you all very soon.